Well, welcome everyone to the Aesthetic Blueprint podcast produced by Symplast, where we discuss the intersection of technology, strategy, and business growth in medical aesthetics. I'm delighted to have the opportunity to chat with Dr. Kenig, certified plastic surgeon residing in Mallorca, Spain, and who I had the pleasure to meet during the ABAM meeting in Park City.
Hi, Facundo. It's really great to be here. And it was great getting to meet you in ABAM. My name is Dr. Kenig. I'm doing my research on applied AI and plastic surgery in the aesthetic world. I've been a plastic surgeon for quite a few years, but ever since I started, I was very interested in technology. And I was always searching for a way to include this technology into my practice. And AI was just a great way for me to find finally the way to interact with this passion I have for technology and find a way to use this in the aesthetic world and the plastic surgery world.
I have to say, I found your presentation fascinating. With my engineering background and deep connection to AI and machine learning, I was especially impressed by your approach. I appreciated the way you framed your insights and you post them or you presented them by posing many different questions, some rhetorical, some pointed, which made it a very compelling and thought-provoking presentation. So could you just share initially, what drew you to study AI in aesthetic medicine?
Well, I think this new technology that's appearing now with AI is just making everybody ask ourselves very deep questions about actually the meaning of everything. And the amazing power of AI is transcends actually medicine. So whenever I talk about it and think about it, I always also think about the greater implications this has for our society. Of course, we have to be also pragmatic and learn to use this in an everyday kind of sense. But I always try to remember that as a doctor, we're continuing a very long tradition of using technology to help our patients. And in the end, it's our job as physicians to actually find the best technology there is in every given moment in history and learn how to safely apply it. So this is one of the few questions I ask always the public, and I ask myself, is this a correct ethical pathway? And if so, how should we do it? Because of course, otherwise, when technology is not used correctly, it can cause perhaps some distress or concerns. So the most important thing is to speak about it openly and address the difficulties. And that way, with the help of technicians, of programmers, of engineers, we're always trying to help patients and always try to help advance ours.
And one of the things that you mentioned, if I recall correctly, is that based on your research, AI is achieving about 90% accuracy in answering clinical questions. Can you break that down for us?
Yeah, so of course, AI has been working for many years. And what became very famous now are the large language models, of course. So we have very famous names like ChatGPT by OpenAI, and of course, many, many other systems that are coming up. And one of the main studies that we can see, because it's so accessible as natural language, is just interacting with AI-based models for patient education. So what has been very well tested out is knowledge of different systems about medicine and specifically in aesthetic medicine. And in many studies, we've seen that you can actually ask specific questions about procedures and the AI models are very, very accurate and they are consistently getting better and better. So of course, something I like to say is that all the AI technology that we have today is now in its worst position when we look forward. What I mean with that is every day it will get better and better. So if we're talking about 90% in some studies, it could be, of course, a little lower or a bit higher in different studies and in different models. But what we can see is that it's achieving better and better results. So we can look forward just in the few next decades and just in the coming years that AI will become more and more accurate when, especially language interactions. So we can have patients directly talk to AI. Of course, this brings some concerns to mind. But then again, the better the technology gets, the more accurate the information is, we can actually see great benefits in AI. So previously you would have to go through some difficulties to get information, especially clinical information for patients. And now we can see that in the coming years, AI will become more available. And of course, the more accurate it is, the more it can help people. Now, this will bring us to some also interesting questions about the doctor-patient relationship. How will this be used as a force for good? But of course, the increasing accuracy is the most important point at the moment, because we want to make sure everything is correct. And of course, once we achieve this really human-like or even better than human accuracy, this will definitely bring up some interesting questions about what medicine will look like in the future.
I agree. What I do like from what Microsoft is doing from a naming convention, they keep referring to any of their products as Copilot. You can think of Assistant as well and whatnot. So I wonder if you agree that that's where we are today, where AI help us navigate whatever subject we are dealing with, and it's great as a co-pilot, but not necessarily as a.
Yeah, I think that's a very, very interesting conversation that we need to have, and I think it's not just a branding point; it's actually just a reality point. So I think the idea with the pilot is a great example, because when technology started and planes used to be piloted just by humans, and in the end, it's not really AI, but it is technology that's helping us ensure that flight is becoming safer and safer. So in a sense, the pilot is using this technology to help them become safer pilots and more efficient. And I think in the terms of technology today, it definitely is it's an excellent assistant, because it can help you write documents, it can help you correct documents. And I think this is just a natural evolution. So of course, we had just a spell check many years ago already, but this was actually kind of a beginning. The second AI is helping you, or a technology is helping you write, it's actually helping you think, it's helping you analyze. And this is going to get better and better. So I think definitely systems that are good for today and for the coming years will definitely not replace humans, but they will help us be more efficient. So I like to give the example that if in medicine, we usually have residents with us, we have people that we are and a kind of apprenticeship with us. And very often you would get great professionals. So they're not just there to learn, they can also teach you, and they can also help you, and they can also correct you if there's a mistake. So the more eyes you have on a process, the better. And I think AI can be a great assistant in these terms, because if I make some kind of a clinical mistake and I have AI constantly monitoring, I just say AI, of course, this can be any kind of model, any kind of system, but we're going to have a technological assistant that's going to make sure what we are doing is correct. And I think this is definitely the way forward. And I don't see ourselves living in a completely science fiction film just in 2 or 3 years from now, of course. But I do think that we're going to rely more and more on these kind of technologies that will help us just make any kind of interaction safer. So this can help you when you're interviewing a patient, if you forgot to make an important question. So it's like a checklist, but it's much more sophisticated. And a checklist would also interrupt a human conversation. So instead of having to review kind of a book, I could have kind of a little note on the side saying, remember to this, now let's do that. I suggest this as a next step forward. And I think this is definitely the co-pilot idea makes a lot of sense to me too.
Very good, very good. And I love being an engineer. I love how you keep mentioning that AI is just one of the hot keywords today, but really there's has been technology where machines are learning and helping humans in so many different ways. And today we are generalizing all that under the AI keyword, and I think that it's okay, but I do appreciate your disclaimers every now and then saying that it's not just AI, but there's many other type of technologies. And, tying it a little bit to what Symplast does and I do as a software engineer, How do you see some of these developments in AI addressing or helping or being the co-pilot for the evolution of practice management specifically, not just the medicine side, but the business side?
Right. So this is a very interesting question, and actually, that's what I usually talk to doctors when I'm talking about all these new systems. So the first thing you think about when you, as you said, you mentioned AI or any other technology, we are often very defensive, and we're thinking, wait a minute, is this going to replace the doctor? But actually, I think the fastest and easiest way for these technologies to help us is on the management side. So these some of these processes are more easy to make efficient. So for example, we have all the extra time physicians need to spend when they have their own practice in the business side. So they have to spend a lot of time that's not really based on interacting with their patients as a doctor, but more as the in business related issues. So these definitely can be, and I won't say it won't be automatic because it will be personalized for each patient, and of course it can be customized by and every business owner to their own idea and their own philosophy. But definitely it will help people be more efficient, and this is why I think this will be the first step. Often I talk about new technologies in a kind of a philosophical way, so I always tell people that they've already been interacting with these technologies before, they just don't know it. Those are often technologies that are already in place and are being used for many years now. And definitely the first wave of big AI will be, firstly, I think, with business management, with just perhaps organizing emails in and lists with patients, organizing, scheduling, and of course, managing all these expenses. These will be technologies that AI can help you with efficiently.
Exactly, exactly. And this is not about replacing human. This is about making humans more human, giving them time back and removing that friction of having to do commerce, and repetitive tasks. You also mentioned automating task management, controls, and checklists. I think that is a great application and is coming. And then in the immediate future, or really today, where do you see AI helping doctors while they are practicing medicine?
Well, actually, the example I like the most is more related to the work that you're doing, um, especially in terms of helping interaction with our patient. Doctors and physicians, we learn to write our notes while we do the consultation, but we actually go into medicine because we like interacting with the patients and we like our time to be spent on meaningful tasks. So of course, it's very meaningful to write the clinical history, but it's meaningful in a legal way and kind of a personal note way. But it definitely takes time away from what we really want to do, which is spending time with our patients. I think the first and easiest methods will be any kind of system that helps you with the interaction with your patients. So that's writing down the notes, writing down your conversation, perhaps making a summary of this. Of course, this has to be well made because this isn't any kind of conversation. It's a medical conversation. There are some legal aspects, but especially the aspects that are with patient information that is important for us to make clinical decisions. And of course, because it's private data. But once we get over those first hurdles, there are great ways to apply that. Of course, there are some other technologies that perhaps can offer treatment to the patients. There are
I totally agree. And as we know, at least many of us that are looking at the progression of AI agents are pretty much here or coming, and that is the type of thing that we at Symplast are doing when it comes to um, automating or assisting physicians and their staff to take care of some of those things, right? Like ordering labs or ordering, the different areas that the patient needs to do, like get the clearance from their doctors and things like that. So it is very interesting. And
of course, you said agents, which is definitely the big word right now, because we're having technology now act. It's not in its own, but it's more and more autonomous. So definitely AI agents is the big word of the future because we're getting to the point where AI, it doesn't only, like I just mentioned, write what I say, but it can also make decisions based on previous information that we told it to do. So of course, that's a great way to use AI. And I do agree with you that we are lucky to be living in this time, because just like you have a passion for the technological side, and I have the passion for the application in the medical side, we were lucky to find how this big AI wave just came up as we were working on these kinds of projects. And what I talk a lot about is really the how important and how big this will be historically in medicine. Because as one of the examples I give, so there was the theory of the cell when medicine started out with biology, and the theory went that every organism was made of cells, and the cells divided, and then a cell came from another cell. But this was just a theory until we had a microscope. So I think AI will be just as big in the sense that it will take such a big part actively in medicine, to the point where a doctor will be training their AI agent to do their work. Eventually, it will be an assistant, but it will be a big part of medicine. And I think what's interesting is that the agents aren't actually made by doctors. So they are made from the collaboration between physicians and engineers and software engineers, in this case, like yourself. And this is very interesting how we are actually shaping medicine by joining different parts of society, and how important every decision is at the moment. I think it will definitely shape the future of medicine, because how humane the contact will continue being after this revolution is directly related to what we are doing today. So when people like yourself collaborate with physicians and make sure that we are maintaining the core values of medicine, this is what really makes me sure that the future will be a bright future with AI and AI agents. And of course, that's the most important part, that we are actually giving something back to society and making it better.
I want to circle back, and I think it's a good segue to trust and ethics in AI. In your presentation, you address some of those ethical challenges, but what is your approach to handling specifically AI bias in aesthetic medicine?
Okay, so of course, bias is a very interesting situation, but when you think about it, every difficulty that we find in AI is actually it comes from our society. So whenever we have bias in AI, it's because there is some bias in the data sets which is where the AI model learns from. So these data sets actually come from human society. And what I think is very interesting when we face bias in AI models is that AI is actually just a mirror of our society. And often when we look at our society through different eyes, we can find biases that we might not have seen before because we grew accustomed to them. And I think the approach is just to make sure that we know what's going on, that we know why it happens, because there is a technical reason for these biases, and there are ways to fix them. But also sometimes the solution is actually a problem because we're trying to censor kind of an output of a model, which isn't always good either. So again, we have some kind of controversies about biases because we don't know what is the correct balance between safety and censorship. And these are actually societal questions. So of course, I don't have the answer to that specifically how to solve it. But one of the ways forward is to make sure that we're not repeating biases, that we know how to control them, that we know why they are there, what part of the data set or the information that we fed the AI model gave way to this bias. And these are great ways to solve it. I think it's a very good example is if one of your children goes out to the street and uses language that you don't like, but then you have to think about it. Perhaps they heard this language somewhere else before. This is just the same thing with AI. So I think I wouldn't consider it a great worry or concern or a setback. I just think it's one of many things that we need to make sure is correct. And of course, we've had some publications about bias in AI where we found that AI in image generators represented the human body, especially female body, in biased ways. but we know why this happens and we can definitely control it. What is interesting though is that AI is starting to become a content creator as well on social media. So this will be very interesting to review and to control. Again, the limit of censorship is difficult, but once you have AI content creator agents creating content, again, this will be a very interesting issue to make sure we don't create a lot of bias with it.
No, I agree, and certainly a topic that could take us a few days to discuss. And then when it comes to the patient, we are talking about trust and ethics when using AI, but the patient needs to accept AI as part of their journey when they are interacting with physicians and surgeons. You have highlighted some interesting data about that, so I would love for you to share that with us.
Acceptance of AI is a very interesting issue because I think that we need to think forward and just envision the future for a moment. As of course AI is going to become more and more potent, we will be relying on it more and more. But in the medical field, we have conversations with the patient that needs to accept all kinds of treatments, but part of the treatment is also the instruments that we use. Now, because AI is becoming so relevant, people are starting to have their own opinions about it. Some of them perhaps misinformed, or some of them based on their own views or fears or worries about technology. But at some point, we definitely need to address the fact that the patient is the last line of defense of what I will use with the patient. Now, when I set out to study what the acceptance rate would be with patients, I was actually thinking they would not be so open about it. But to my surprise, we had very high acceptance rates. We've had only some preliminary studies, but most of the patients completely trusted AI models for their care. And what we did notice is that most patients also relied on the doctor to be the ultimate responsible person for the use of this technology. So what I think was that patients accepted me as a physician using AI tools because they trust me as a physician. So in some part of the trust is still based on the human aspect of medicine. And on the other side, people tend to understand that technology is there to improve our lives. And I think over the last few years, everybody who is interested a little bit in AI can see how this is evolving and how it's becoming better and better. Of course, there are some examples of errors, but these are more few and far apart. So I think people will come to accept AI. That's what my initial review was. Patients accept us using technology because they are used to using this technology themselves. And I think it is very important to take that into consideration in the medical part, the fact that patients would like to know what we use and why. And this is also just based on the information we give them. So if we use any kind of AI tool in the care of a patient, we can tell them and we can let them know about it. We can let them know what this tool does and why we're using it. It doesn't need a lot of time to explain, but actually, I think an interesting part is the other side of acceptance, which is expectations. Because I've had some patients in my consultation asking me specifically if I would be using AI within their case. And if I didn't, they were, and actually, if I didn't use AI, I think some were a little bit disappointed because they want the best technology. So as long as they know what's going on, as long as they trust the physician, and as long, of course, as the physician makes sure this tool is helping the patient, I think there can be a very positive way forward with this technology.
I totally agree. I like the way you're comparing to or relating that patients want you to use the latest technology possible, right? As long as it's proven technology, as long as it's used correctly. But that actually goes to show the trust on technology from patients. I can only imagine that as we continue, or as AI continues to be pervasive and in the hands of everybody, they're going to demand it rather than concern.
Yes, I think a very easy example is how we use Google search, and now these models are becoming better and better. We're used to having information immediately, and we do want to have the best information as fast as possible. And the same as AI is now starting to change AI search engines, and this is becoming a big revolution in that part of technology. I think the same will happen in medicine. And I like to give my own example of how I use large language models to diagnose. Of course, I'm a physician, so I can make sure it's true. So I use that to diagnose my dog with a problem that they had, and then we took the dog to the vet, of course. But I used it on plants, and I was using it to see what it would feel like as a patient. So I wanted to know what it feels like when you don't have the information and you really need an answer, and how and how comfortable it was to be able to consult things immediately with AI models. And I think the same will happen with medicine.
Agreed. And so you mentioned a little bit on within medicine, we cannot forget about the human aspect of it. And I think that you cited some content about emotional artificial intelligence.
Yeah, so I have a few colleagues who are psychiatrists and psychologists, and we've been reviewing what the emotional response of patients will be to AI. And I think what is very interesting is this is so new that we don't really know what will happen in the future. And I think humans just find a way to interact with the technology. And I think we always find the best way forward. What's very interesting about the emotional response to AI is how patients actually can find a lot of empathy, because AI learns to speak like us, and it learns to find emotional and empathetic conversation. So sometimes I've seen even examples of patients preferring chatting with an AI model because it was more empathetic and more available to them. And sometimes we can go as far as thinking about science fiction and movies such as the famous Her, where a person falls in love with an AI model. So in terms of medicine, I don't think we will get as far as that, but I do think we can develop some kind of a connection to AI models as they get better and better at interacting with us. So I think, of course, we have to look at the other side, where conversations with AI models have the risk of dehumanizing us. But I don't think this will really happen, because humans, we always find a way to express our emotions, to express our empathy. And I think that we should be optimistic about finding good ways forward in terms of the emotional connection and maintaining empathy in an AI-dominated world.
Agreed, and I love that positive outlook. I think that we always need to remember that at the end of the day, it is about creating those positive connections, and the technology should be here to assist us, not to replace it. So this has been very, very insightful. From a future vision point of view, like based on your research, what do you think the developments are that you should be watching for in the next 2-3 years?
Well, I think one of the things you mentioned are very interesting. I think that without naming companies, but the co-pilot idea, I think the idea of AI as an assistant for us in the future is the best way forward, because this way we're not changing or transitioning too fast. We're making sure that everything is maintained in the same standards as before in medicine and in the rest of society as well. And we should be making sure this transition is correctly done. And what I mention a lot is about how we are actually the first AI generation. And I think we are the founders of this new AI society. And I therefore think we have a lot of responsibility on our shoulders to use this technology wisely, to not be afraid to face the challenges of what it means to rely on AI for conversation, for improving human relationships, especially in the professional aspect. And this great change that we will see, I think, in the coming decades, how big this moment was, is what makes, I think, the present very important. So the way we use AI today is very important about in the sense of how it will shape the future. And I think work like the one you are doing, helping physicians treat their patients better, being more available to spend time on the human aspect, this is making society better and it's making medicine better. So I think I will be centered about how AI can enhance us professionally and how we can transition correctly to this new technology that is like a tsunami wave. And I don't think we can avoid it. I think we should just face it, go into the water and find the way to swim to a safe shore and actually be responsible for a good future in all of society in terms of AI.
Very good. That is a great closing statement. I love it. Thank you so much, Dr. Kenig. I really appreciate your time, your insights, and the research that you're doing, that you have done and you're doing. For our listeners that want to learn more about all the fascinating work that Dr. Kenig is doing, you can visit drkenig.com, right? KENIG.com. And for those that are interested in learning about Symplast, symplast.com, SIMPLAST.com, and of course our social channels. Again, Dr. Kenig, thank you so much. Have a fantastic day.
Thank you very much for having me. It was a pleasure speaking to you.